interested in this because I have a medical IT company in my district, but I'm very curious as to if we can't afford this, and I'm worried about, particularly, Mr. Hannon, I'd be curious too because I represent a very rural district with very rural hospitals, and they seem to be as worried as anybody is about how they're going to implement this. My question too is: are we to the point where they're all these systems are going to communicate with each other? I know there's different systems out there, and being able to talk to one another is something that concerns me. But the bottom line is, can we afford it right now? I mean, we've got so many things on our plate with increasing healthcare costs, and I'm just worried about that and where this thing is going. I'd like for you all to comment, but Mr. Hanna, I'd like to hear you first.
Thank you, Mr. Graves. Congressman, the hospitals believe that we are early adopters and seek new technology. And it is our belief that health information technology is important for us to the future. You have hit on the important points. How is it we're going to be able to afford it, especially in our small rural hospitals, who many are running at negative margins today? The money needs to come from somewhere up front, and our ability to fund those up front is certainly concerning in small and rural hospitals. We believe that long term, that is the best thing we can do is to bring technology in, and it is our belief that over time we will see some returns on that, and we can lower the cost of health care for all Americans if we had technology. If we're able to share information with our physicians, even between communities to other hospitals, where we're not duplicating tests. We are seeing what prescriptions patients are on. We believe that we can improve the care of the patient, provide a safer environment for our patients, and assist our physicians in caring for those patients even faster. As we look at issues of how are we moving those patients from acute care facilities to post-acute care facilities, a part of what the President's budget proposes, that sharing of information is critical if we're going to reduce the cost of health care.
Dr. Moffitt, we can just go backwards.
Will health information technology save money? Will it be a way to significantly reduce health care costs? I don't think anybody really knows. Congress passed a health IT investment of about $20 billion. You didn't have many hearings. In fact, I don't recall any hearings on the proposal when it was passed. I know that within the medical profession, as has been evidenced by columns by members of the medical profession in some prominent newspapers, including the Washington Post this week, that there is grave doubt about whether, in fact, health information technology will save money. I think one concern that a number of us have is that with the government superintending the development and the dissemination of healthcare technology, information technology, we may end up creating a regulatory straitjacket in this area, which could undermine innovation in one of the areas of the economy where innovation is a daily occurrence. So as I say, I think the jury is out on this. Mark Poley at the University of Pennsylvania, top-ranked economist, has made the point publicly on several occasions, and I think before Congress, that the success of this all is kind of a what-if proposition. That is to say, what if you don't get the kind of cooperation from all of the members of the medical profession you need, or the cooperation you need, from different sectors of the healthcare industry to accomplish all of this? I mean, there are a lot of, in other words, there's a lot of factors here that go into whether or not this will actually bring about the kind of savings that many people hope will come about. I have no strong feelings on it. I think the jury is still out.
Would the gentleman yield?
Yes.
Conduct one, but several hearings in this committee on HIT and the impact on solo practitioners and small business practitioners.
I was only talking.
I invite you to
Right.
read the record because it could be very enlightening.
Fine.
Thank you for yielding.
Dr. Preston.
Thank you very much. Just to add to this, health information technology certainly is important, and we appreciate the President considering it and elevating its importance to the record. I don't know that the issue is just the cost savings with health information technology, but improvement of patient care and safety. The President pointed out in one of his statements about the senior citizen who must remember his or her history at every doctor's office he or she may attend. My father is 89, has Parkinson's. He's sharp, but he doesn't talk so fast. Things are going to get left off. If a health information was part of a system where